Hello, it's Dr. Rhonda Johnson. Today is Monday, May 9th, 2022, and today I'm going to be talking about relapses after Paxlovid treatment for COVID-19. Well, first, what is Paxlovid? It's that oral, twice a day, 5-day total duration medication made by pharmaceutical giant Pfizer. Now, it was authorized for emergency use authorization by the FDA in December 2021 for people who test positive for COVID and who are 12 and up and who weigh at least 88 pounds and are at high risk for progression to serious COVID-19 infection. And remember, serious COVID infection means you're at risk for hospitalization and death. So now, after about 4 to 5 months of increased usage of Paxlovid, doctors are reporting a few cases of rebound or COVID relapses. So what is happening, folks? Well, it looks like patients are getting better in the first couple of days of this 5-day treatment course. They may even test negative on rapid tests, and then they develop COVID symptoms, usually within a week or so after finishing their 5-day course. Now, there was one preprint case study of an actual patient, and they did repeat genetic sequencing of his strain of the variant and shown it was the same COVID strain as the original, meaning he didn't get reinfected. So the FDA is currently investigating reports of viral rebound after Paxlovid treatment. But what's interesting is investigators from Pfizer observed these relapses in their clinical trial, which was called EPIC-HR, and reported it to the FDA. So Pfizer has reportedly said that about 2% of participants in that trial experienced a rebound compared with about 1.5% of those on placebo. Now, if you're a Paxlovid patient and you're having a relapse, it's important to know that if you're symptomatic and you have a positive antigen test, you should behave as if you're contagious and can transmit the virus to other people. So now, what happens if you have a rebound? Should your doctor prescribe a second course of treatment? Well, some clinical experts do not recommend retreatment with a second course unless you're severely immunocompromised or medically vulnerable. The bottom line, folks, is that anyone who is taking Paxlovid, in my opinion, should know that this relapse is possible. And how likely, I don't think anybody knows for sure just yet. And it's also important to remember that it's an investigational drug. It should be prescribed by a doctor who is following you, and a prescribing doctor needs to know your medical and clinical history and what medications you're on. That's my message. As always, consult your doctor for medical advice. Take care, folks, and be safe.